guys, it's Natasha with Athletic Edge Physical Therapy. Today I'm going to be showing you some hip joint mobs with the belt. So today I have Melanie. She is going to be my lovely patient for the day. And first off, I'm going to place a towel right on the hip crease of the hip that I'm mobilizing. Melanie, can you please place it there? All right, so I always do that. It's just for modesty, but it also provides some cushion for the belt so you don't get pain when mobilizing. Wrap it here. Yeah, go ahead, Melanie. Place it where you feel comfortable. And then I come around, relaxingly, and I just hook it right in the back, and then I pull it down, like so. So it's gonna wrap around your glutes. This is the driving force. So again, it's tucked in there. Melanie, can you just pull it into your hip crease more a little bit for me where you feel comfortable? And Melanie, just come a little bit closer to the edge of the table. Thank you. So here, I'm going to be mobilizing hip external rotation. So I'm going to come to her end range, and I'm also going to palpate her ASIS, because with this, sometimes you think you might be getting more movement than you're actually getting, and it's due to the ASIS pelvic area moving. So I'm going to palpate that, come to her end range, and I'm going to have a free hand to palpate, and then also palpate the greater trochanter. Okay, so first I'm going to do a test pull. Okay, so I'm using my glutes and my hips to help power me. Melanie, do you feel a hip stretch, or am I cutting more into your thigh?
Hip stretch.
Hip stretch, okay. If the patient was to say it's cutting more into the thigh, I would again either adjust the tightness of my belt and or have the patient make sure it's pulled up in the crease. If it's too far down in the hip, you're pulling more into soft tissue. Okay, so I'm going to laterally pull, come into that first barrier, feel the greater trochanter into my hand here, and then I'm going to come to her end range, and right there you can do some external mobs. So you can do some grade 2, grade 3, or you can just do a nice stretch both sides, so stabilizing the ASIS and getting a nice stretch. Melanie, you feeling a stretch there?
Mm-hmm.
Good, and they should be feeling it on the lateral portion. So again, this is going to help with your external rotation, and then we can also do for hip inferior distraction, which will help with her hip flexion. So again, you want to feel down in the inferior glutes, pull there. Melanie, does that feel okay?
Mm-hmm.
So I'm going to hold there, and you can again do the hip flexion mobs this way, or hold and just do a nice stretch. This one might be a little bit more tender for people because people tend to be very tight in their hip flexors. So I would suggest doing your soft tissue mobilization and stretching beforehand to soften up this area. Okay, thank you. Okay, so to follow up on the hip mobs, I'm going to show some shoulder mobs with the towel and belt as well. So I'm going to actually just show scaption and abduction and a posterior mobilization of the shoulder. Here. Okay, thank you, Melanie. And then behind my back is I'm going to sit back into the belt. And that's going to posteriorly mobilize the shoulder. I'm going to feel the humeral head come back. So I'm feeling here, again, making sure you're not rotating the person back. So here we go, I'm going to push back, and then we're just going to raise up like this. So right now I'm just doing some passive, but what I found most effective is having the patient do some active range of motion. So Melanie, go ahead, do this 10 times with me. So more so active assistive. Good job. Some good shoulder scaption and some horizontal adduction. Right through there. Good. And I'm coming to the side a little, getting a little lateral distraction as well. This is a good one. Good. Okay, good. All right, so I just wanted to show from this angle as well, the shoulder mob. It's a little bit easier to see from the lateral portion instead of the front portion. So again, it's behind my hip, and I could feel the humeral head pop back into my hand, so I'm going to mobilize and then come up into abduction, or come up into your scaption.